Hi everyone, very good evening, guys. I hope I am audible and visible to all of you. And I am very happy because for the first time, I think I'm going to virtually share the platform with Neha ma'am also. So, welcome, ma'am.
Hello, am I audible?
To me, yes, ma'am. Rest, I think the students can help us know. A quick thumbs up, guys, if ma'am and myself we are audible to you. Yes, ma'am, we are. We are all good. So this is actually I was talking to we were also discussing like since evening ever since you
Mhm.
guys have come back from the exam. I think all of everyone is just talking to everyone. So we thought that rather than all of us talking to and ma'am and myself talking to each other, it's better we talk to you and find out that what has happened. So ma'am, I'll start with you. What is the overall response about the paper 1 and 2 that you have got from your students whom you've interacted with?
Okay, so I'm so happy to be here. I think we are sharing this screen for the
Yes,
first
ma'am.
time, right? है ना? Um, so अभी तो exams हो गए. I think all that matters now is not to worry too much. Let's hope for the best. What I got a feedback कि paper one was good, paper two was moderate.
Yeah.
But if I have to talk about PSM, there was this time we didn't have that many questions. जितना last time था, थोड़ा सा कम था, and there were a slight, few of them were slight tricky, but rest topics were almost the same जैसे आ रहे हैं. Like epidemiology में they again asked case control. The topics were same, but then yeah, it was a little tricky and questions थोड़े कम थे. ऐसा बच्चों ने बताया.
Right. So overall PSM में I believe the trend has become के मतलब anytime number of questions is not a thing but overall मतलब even for FMG they are moving a little closer towards the NEET वाला pattern, right? I mean in terms of the
हाँ.
tough level of questions.
Yes, exactly. I mean, अब ना पीएसएम में नीट पीजी एंड एफएमजी के क्वेश्चंस में बहुत डिफरेंस
नहीं.
आई डोंट सी. मतलब if you are preparing for FMG you should see the NEET PG questions also, and if you're preparing for NEET PG you should also see the FMG questions also. So I don't think there's too much of a difference now.
Correct.
टॉपिक्स आ रहे हैं, क्वेश्चंस दोनों पेपर में बहुत अच्छे आते हैं, तो आई थिंक अब थोड़ा सा वो चेंज हो रहा है that it's no longer anything separate that you have to prepare for either of the exams. I mean, when PSM is, I think, coming into picture.
Right.
What?
So anything guys you wish to, tell us, talk to us, ask us, and I think abhi ke liye to you must be so exhausted. I think ever since they have
हाँ.
walked out at 5:30, we have bombarded them with so many recall videos and all of that. So we will talk about NEET also. That is there. I think more than FMG students now, a lot of NEET students are also worried about it. So we'll deal with it. One by one and yes, so नीट के लिए गोइंग फॉरवर्ड आई नो एवर सिंस ऑल दिस recall has started 2-3 घंटे से कोई पढ़ा नहीं है because obviously your
हाँ.
mind has gone towards that what came in the exam today. So obviously you can never study when you know that everyone else is discussing questions your mind and you do get distracted. So my first and foremost advice to you is that right now after spending 2-3 hours on YouTube and everywhere you have got a basic idea, right, that this is the level of questions that came for most of the subjects. If not all 300, at least 150, 180 questions you guys have analyzed from here and there. So now shut it. Okay, so now just put it aside. And after that, you can now, maybe in a day or two, once the official videos with all the questions and answers and discussions, particularly for you guys, are put up, then you focus on that because then the discussion will be pertinent from your point of view. You will know that how to approach that question for the NEET exam, right? And yes, you are right, Dr. Arjun. The second paper was tough and under stress. Tougher things become toughest. So yes, that is very right. Neha ma'am, students are also asking Mira abhi. I think many of them have attended the recall session right now. So any questions that you felt which meant to be discussed, if I can project a few questions, you can quickly go through them. I mean, they know the answers, I'm sure, but jaldi if they want to just go through
हाँ,
some
definitely.
questions.
कुछ questions we can have a look.
Right.
Whatever, I haven't been able to gather a lot of them, but try to come closer to the questions. what the students sent. अब जैसे somebody sent me a question on case control. Okay, it was something to do with autism vaccine, something. It was a mixed kind of question. So I don't know if it was exactly the same question, but that's how I could frame it. Like here you can see, and this we have, in fact, we were taking TNDs in our epidemiology test. We have discussed a similar kind of same question. हमने मतलब ये question मैंने उस TND से ही लिया है, because that's what I received from the students कि ऐसा था. Now, if you look at this question, if this was the question, British investigators conducted a study to compare MMR vaccine history. Okay, so the first thing that you get here is history. History means you have to go back. So one thing is very obvious कि हम इसमें retrospective जाएंगे. Okay, and we've divided it into among 1 to 9 for children with pervasive development disorder, or let's say autism, whatever, and 4469 children without such disorders. So we had also learned in our classes that whenever you have to identify a study design, you have to take an approach, है ना? Figure out what is the exposure, figure out what is the outcome, then figure out, are you moving forward, are you moving backwards, or are you standing at the same place? ठीक है? So, and what are you comparing? Are you comparing exposed to non-exposed, or are you comparing diseased and non-diseased? So it was very obvious over here that we had two groups. One had the children with autism, मतलब diseased, और दूसरे जिनको नहीं था such disorder. So they were non-diseased. ठीक है? और फिर हम पीछे जाके हिस्ट्री ले रहे हैं that did they receive MMR or not. So if it, many of you might have got confused कि कोई ट्रायल तो नहीं है क्योंकि वैक्सीन की बात हो रही है, but we are not giving any trial over here, है ना? तो we are just taking a history of vaccination among diseased and non-diseased. तो इसीलिए ये हमारा RCT नहीं है. We are not going forward, पीछे जा रहे हैं. So if this was a kind of question, so definitely the answer to this was case control study. What I could gather from the students कि ऐसे पूछा था, so definitely इसका answer case control हो जाता है. Although we'll have a more detailed recall session, okay, when we get a lot of other questions as well. Abhi, it's just like, everybody is trying to put their own version of question and answer. So this is the closest we are trying to come up with.
Right. We have a question from Dr. Pratyush also about what to do in the last now, especially now for the NEET PG. So I think that also will take up just two, three quick more questions, ma'am, that you can help the students with, and then we can take the questions from the.
Yeah, most of them like levels of prevention. मैंने हमेशा क्लास में बोला था, एक topic जो used to come when we were giving exams, when you will give exam, when anybody else, your
This even
children
I
might be.
remember. I remember
है ना?
giving this in
हमेशा
math.
हमेशा मतलब मैंने जब supersonic revision also I did know. So the first topic I taught was levels of prevention. And FMG exam में they have always been given for the last 2 to 3 years. So what did you all mark for this question? Hand washing is which type of prevention? हमने इतनी बार पढ़ा था ना इसको, that this was again kind of a repeated question which we have already discussed it. Risk factor, if the risk factor is not present, it will be primordial, है ना? Like don't start drinking, don't start smoking. But if risk factor is present but disease has not started, primary. You are already drinking, you are already smoking. Secondary मतलब क्या होता है? Disease शुरू हो गई है, disease has started, but you can make it, it is reversible. There is no complication. So basically we are not letting people progress into late stage of cancer. Sign symptom आने से पहले ही पता कर लेंगे. और टर्शरी में क्या था? डिजीज जो है इरिवर्सिबल, कॉम्प्लिकेशंस आ गई हैं. यू आर लीविंग स्मोकिंग आफ्टर यू हैव suffered from a paralytic attack or something, है ना? So over here this was very easy. Hand wash क्यों हमें करते रहना है all the time? Because already so many risk factors are there. We are touching this, we are doing this, we are doing that. So this was a pretty good question and a very nice one easy mark जो हमारा था. It was a primary level of prevention.
Right.
Yeah.
So I remember giving the सेम मतलब आई थिंक लाइक यू सेड ये एवरग्रीन क्वेश्चन है. आई गेव नीट पीजी व्हेन इट हैपेंड फॉर द फर्स्ट टाइम इन 2012. तब भी ये क्वेश्चन आया था. नाउ वी आर इन 2023. इट इज कमिंग इन द एफएमजी एग्जाम. सो दिस विल ऑलवेज एंड ऑलवेज remain, I think, valid till the time we are there. So I think there was one more question again on the same thing.
Yeah, Tobacco Act. What did you guys mark for this? Now, if exactly Tobacco Act mention था, ठीक है, so you need to थोड़ा सा पता होना चाहिए कि Tobacco Act करता क्या है. Tobacco Act is trying to reduce everybody's tobacco consumption. Okay, so can we just go to the next slide? See, that is why many students kept on, messaging me कि मैम tobacco act में primordial होगा, primary होगा, क्या होगा. So इसीलिए I just brought a line for them to make it a little more clear. ठीक है, the government of India enacted in 2004 its comprehensive tobacco control law. Okay, and if you can see the last line here, it already says to reduce tobacco use. Okay, that means we are assuming that people are already having that risk factor. So when this act was adopted, we wanted to was brought into picture. We wanted to reduce tobacco use because risk factor already present here. People were smoking; they will go and smoke in public places. All right, there is more of trade and commerce. जो हमने मैक्मिलान थ्योरी में भी पढ़ा था. ठीक है, सो बेसिकली अगर कोई लॉ आ रहा है तो इट्स गोइंग टू रिड्यूस इट वांट्स टू रिड्यूस टोबैको यूज लाइक दे आर मेकिंग सिगरेट्स एक्सपेंसिव. ओके, सो मोर if this was the question कि टोबैको लॉ या एक्ट किस लिए है, so that becomes a kind of a primary level of prevention only because we want to reduce tobacco control over here. Already the people are smoking. So that is something which could, and it is very, it's not strange कि level of prevention से ही दो question दे दिया. इतना common topic है. एक दो और question देखते हैं and then we can
Yes, and Dr. Bhavya, exactly what we are coming to, quickly running through the questions once, and then we are going to primarily address the NEET PG students only for that.
yeah. Then again, I roughly received this कि IMR per how many live births. Now, if you remember everybody, class में जब we were doing formula revision, I told you a very easy way to remember कि maternal mortality is the only formula which we are doing in community medicine जहाँ पे 1 lakh is the multiplier, है ना. तो 1 lakh तो एकदम ही out था. It was out because maternal mortality rate हो, ratio हो, whatever, both the places we were only multiplying with 1 lakh. So that was automatically out. Now, when we were doing preventive pediatrics, हमने पढ़ा था all other things, whether it's a neonatal mortality rate, early neonatal, या late neonatal, या post neonatal, या infant mortality, या under 5 mortality, it will always be expressed as per 1,000 live births. क्योंकि 100 कहाँ पे होता है? If you remember, we had done it in the definition of prevalence, या एक दो चीजों में बहुत कम केस फैटालिटी रेट. ठीक है. So here the correct answer was 1,000. We just had to rule out. Yes, we had done it so many times. Like again, out of all the questions जितने अभी देखे हैं, ये भी हमने formula revision में देखा था. And this was expected. A question like this from preventive pediatrics या obstetrics आना ही था. तो this was like a good question, an easy 1 mark, I would say. And I hope all of you have done this question correctly. Exactly ऐसा ही question था तो.
Right. It's okay. And Dr. Jyoti, the rest of the questions, I mean, abhi tak we are totally there. You know, this is a place where educators, all teachers are very helpless. We are totally dependent on all of you. What students tell us, that is, and at the frequency at which they tell us, immediately we will, come back to you. So the entire series of the recall will be there. I think in another day we'll get questions from everyone. So then
Yeah.
we'll have a more ordered, and we'll record videos which you can watch at a higher speed. Also, you will upload them so that you can keep them somewhere saved, and you can refer to them for NEET PG later on also, right? Yes. So shelf life, meanwhile everyone has answered. अभी सब exam mode में है तो साथ के साथ उन्होंने answer
और
लगा
ये भी इतना एक्सपेक्टेड था. हम लोग फैमिली प्लानिंग पे इतना ध्यान देते हैं. तो इंट्रा, मैंने इनको ये बोला था, इंट्रा यूट्राइन डिवाइस और ओरल कॉन्ट्रासेप्टिव पिल्स, एडवर्स इवेंट, कॉन्ट्राइंडिकेशंस और आईयूडीज के शेल्फ लाइफ जरूर देखना. LNG 20, कॉपर T 380 है. मतलब फिर ये बहुत अच्छा क्वेश्चन है, एक easy like good mark के लिए, and I'm sure everybody must have got this absolutely correct. So your answer of course is 10 years. Okay, all right.
I think there's one more question, ma'am, that
Yeah.
but वो अभी complete मिला नहीं था, but yeah.
हाँ, अभी मुझे बहुत ही मतलब इन डिफरेंट डिफरेंट वर्जन्स मिल रहा था। ये तो किसी ने अभी जस्ट थोड़ी देर ही पहले भेजा था कि रूरल एरिया में अगेन कोई मोड ऑफ हेल्थ कम्युनिकेशन है विच कैन ब्रिंग अबाउट अ डिजायर्ड चेंज। इफ एनीबडी हेल्प मी कंप्लीट दिस और मे बी सेंड ऑन टेलीग्राम लेटर, we can come up with a more complete version of the question. So whatever I got, like again this was a repeated MCQ. If you remember health communication में हमने पढ़ा है ORS demonstration. If you want to bring about a desired change, तो हम लोग के लिए best out of all the techniques is demonstration. First you show them how to do, and then you call someone from the community to repeat it, है ना? So ये भी is a repeated topic. Maybe the language or wording might have been a little this thing, but acha question tha, like you could have done it, I think, and most of them might have also done it. Okay, I think this one more question we can take up.
Last question we have, I think.
अब इसमें मुझे बहुत सारे वर्जन्स अभी मिले हैं। किसी ने बोला अ मेल विद समथिंग, किसी ने नाम लिख दिया अशोक इज वर्किंग। आई डोंट नो इफ इट वाज अशोक और इफ इट वाज समवन एल्स, बट इट वाज अ मेल पर्सन, and something he has a family of 2-year-old son and 6 months pregnant wife, something like this was there, and now his elder brother has come to his home. So now family is a also very repeated topic, हमने supersonic revision में भी किया था. So they keep on asking what is nuclear, what is joint, what is extended, what is communal family, ऐसा ऐसा पूछते रहते हैं. अब इसमें क्या हुआ है देखो, there is a family, okay, a person with a son and his wife, they are living, and now just imagine your family also, and now your brother, their family is coming for a visit. So your nuclear family will not all of a sudden become a joint family, है ना? वो तो vacation के लिए आए हैं, and they are staying for you for some time, so it's just an extension of a nuclear family at the present moment. Okay, it's not like nuclear will be shifted to a joint family right now, they've just come to a visit. So extended family की definition क्या होती है? Extension of nuclear family where your uncle, aunties, brother, sister, grandparents सब आके आपके साथ कुछ दिन है और for a long time है. So if this was the question, a suited answer, the closest answer to this gets to be extended family only. That's what I would feel अगर ऐसा ही question था तो, because nuclear will not immediately turn to a joint family. Okay, so it's just an extension of nuclear family which they have tried to ask.
Right. So I think, ma'am, that was some of the questions which students shared over Telegram, and I think by tomorrow, I think, ma'am, you'll be putting up a recall video by tomorrow once more questions come up.
Yes, we will have a recall video by tomorrow afternoon, sometime in the evening or afternoon. I will be sharing on the Telegram group. Abhi we are just in the phase of getting
So
questions.
tonight is going to be quite sleepless. I mean, students are going to sleep बहुत आराम से, but sleepless
Uh,
for all of us because we have to gather a lot of things today and get it ready by tomorrow. But yeah, having said that, I think we need to address the most important thing, and that is we have a lot of NEET PG students who are listening to this recall, and now you and your main target, which is there, that is March 5th. I'll quickly make you rush through what you need to do for Path and Micro, and then over to ma'am for PSM, right? So see, for Path and Micro, first and foremost, some of you might be plus students, some of you might be following the special classes. So I'll tell you for both of you. If you are a plus student, then there is a recent Path Micro Punch जो अभी हुआ था, जिसमें full course Path and full course Micro हुआ है. If you've attended that, then there is nothing else that you have to do. You just have to revise those 40 hours again and again and again. Bar, 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 bar. That's all that we have to do. But if you're a special class following student, then I've given you links, obviously, for the special classes which you can follow. So depending on whichever set of students you fall under, you will be following that. And at the same time, I think ma'am will also agree for PSM also, what you have to do is definitely going to be previous year questions. You ask your FMG friends also now that obviously see, देखो out of syllabus questions, over the top questions, out of the box questions हमेशा आएंगे. That is going to be a part of every paper. Any time in your life you will give, you will see some questions which are out of syllabus, right? But you need to understand that that is something which will be out of syllabus for everyone. What you cannot get wrong at this point of time is going to be the previous year questions, because that everyone is going to get right, and if you get that wrong, then you are in a, in a bad situation. So previous year questions, and by that we basically mean previous year topics is something that you have to go ahead more with. Also, one more thing that you're asking, how much of this FMG can we go forward with? So see, we came back to another point. Many people were, and then we kept telling students, but so much of things were around it, so people were not listening, and everyone thought that siraf clinical is going to be there. Mean everyone thought only USMLE type of questions will come. Every question will be 15 lines or 20 lines, and we'll need 5 minutes on every question. Nothing of that sorts happened. So we had a very good mixture of questions where there were one-liners also, there were clinicals also, image bhi tha, non-image bhi tha, factual were there, integrated were there. So it was a complete mixed bag, and that is exactly what you need to take home from this FMG exam also. That NEET PG ke liye don't feel that you're only going to study the USMLE type of questions and only applied concepts will come, and you'll stop learning all the ratta things of micro or of PSM all of a sudden. You still have to sit and mug it up, you still have to do it, because even if it is a lengthy question at the, like this time a very lengthy question came in the FMG exam, but the last line of that lengthy question was, what are the macrophages in the liver known as? I mean, इसमें कोई concept नहीं है ना. Macrophages in the liver are known as the Kupffer cells. I cannot give you any concept in it. It is a pure ratta question. Beyond this, if the examiner writes a full long history also, he's just wasting your time. So you cannot run away from the fact that you have to learn and mug up some things. वो हमेशा रहेगा. And how will you decide what to learn, what not to learn? That will be aided to you by your PYQs. Your PYQs are your guiding light. PYQs tell you that this topic has to be focused more on, and that topic has to be left. So that if, like, you people keep asking us, give us top 50 topics, give us top 20 topics, and we always say that there is no list of top 50 or top 60 topics. Just keep solving PYQs. That is your list of the most important topics. हम भी कहाँ से टॉपिक निकालेंगे? हम भी यहीं से टॉपिक निकालते हैं. We just analyze the last 5-10 year papers, and we get to know that okay, apoptosis has been asked a million times, so it is a must know topic for all the students, right? So PYQs are going to be the gold standard, not just for path, micro, for all the 19 subjects, right? Yeah, and Dr. Bhavya, if you ask me that whether the PMP, see, it's 40 hours of micro, and I think it's approximately 48 for patho, if I'm correct, if I remember correctly. So if you've done pathology earlier from some source, my advice and very honest advice is don't change your source at this point of time. जहाँ से पहले पढ़ा है, whatever notes you have, whatever videos you have, उसी को follow करना है, right? You don't change your source. Then what you do, you just see a few special class links for the topics which you feel you are weak at, or you're not getting questions right, or your grand test is giving you again and again repeated errors, or low marks in it. Those topics you can quickly go through from special or plus the PMP. Someone following PMP fully right now would either be someone who's been with me since November in this batch, or someone who is still suffering too much with these two subjects and not getting any of the questions right in the grand test. So that person needs to start from a scratch. That is when a person should follow it fresh right now. If you've already seen path micro earlier from whichever platform or teacher, my advice is just go through the links of special class, and that is more than enough. So that is just my set of advice for you. Nothing very extraordinary I told you. I think I told you the most cliche things to do, because honestly, to crack this exam, you have to go by the most old school way of learning for a question for an exam. That is PYQs karo, notes revise karo, bas bar keep doing this till you get sick of it. But that is the way of cracking this exam. Even your FMG students that have gone today will tell you the same thing कि हमने भी यही करा था, PYQs and notes, nothing else we did. And if you've done that well, they will realize some questions, there were 20-30 questions which no one had heard of, never mind. But the remaining questions, if you had done your PYQs, you could answer. Same applies for you guys also. Ma'am, over to you, because PSM is a worrisome subject for everyone, so they need your advice on that.
I would say you've very well said. बहुत ही अच्छे से ma'am has completely addressed, that topics are not going to change and they are the same ही रहते हैं. So we need to have a look at PYQs. And if you look at PYQs for all the 19 subjects, it will give you an order of importance, which is very important to figure out. जैसे अब आज के FMG में we knew that case control cohort has been repeated so many times, it's going to come again this time. So in all our revision sessions, हमने case control and cohort को, like we've given it a lot of importance. So the first thing now, since we have only a month remaining, what we have to do is, if you've done your subject before, if you've not done your subject before, whatever, the first thing, you don't need to change your source or anything. For PSM also, for the plus batch, all the NEET PG students, if you are in the plus this thing, you can refer to the PSM revision which has been done November and December. Okay, there's a batch which has been taken up in November and December. And those who are not, and currently we are having TND, test and discussions. Okay, so it's completely MCQ based. Every day it's happening for 2 hours, 5:30 to 7:30 p.m. So if you have time, if you want to just practice MCQ, and there I've just put all the high volatile topics. Again, how did I figure out that? Like ma'am said, from the previous previous year questions also. So we also look at previous years. So like I've always been telling you, don't run after the 5-10%, which, even to be very honest, we also don't know है ना कि वो 10% क्या आएंगे, but we have to target our 80 to 85% questions. So you can follow that. And if you are not a plus subscriber, just in case you want to see, want to revise PSM, right now the supersonic revision that we took for FMG, that is equally good for your NEET PG also. And additionally, we would be coming out with sessions of PYQs, okay, in this last 1 month, all right. And image ka session, there's also an image session which has been taken, which has 100 images, which is there on the Telegram group also. You can go through that. But the only thing is, the only suggestion that even ma'am is giving you, don't change your source. And don't try anything new now. Stick to your content which is with you, and look at the MCQs. For PSM, I would suggest that abhi NEET PG hai, so please last 2-3 years ke FMG ke PSM PYQs, do go through them. I'm sure maybe from Path and Micro, but I am definitely telling you, for PSM, zarur dekhna, it will be really, really important. So that's what you can do for PSM also. But please don't worry about 5-10% की बहुत लंबे questions आएंगे, ऐसा नहीं होगा. You are going to get a question which would be approachable. And I have seen that even if it's a long question, if you read the last 2 lines, maybe you're able to figure out the answer as well. So don't worry about it. So just stick to PYQs, notes, and consistency. Keep revising, keep revising, keep revising. Don't give up now. That, I think that would be what you could do. Someone has.
Yeah, so I think exactly at the very right time, I think just as ma'am was explaining, someone from last year who cracked NEET
Yeah,
has and is doing radio, so definitely got a good rank, right? And
exactly.
whatever we've been telling, now you've got a live example of someone reinforcing on that double. I mean, I could not see your username, but yeah, so we have this student basically acting like a mordant. जैसे stains में हम mordant पढ़ते हैं, mordant comes and fixes the concept. So same way, mordant is this student. Whatever Neha ma'am was telling you, that student has now come and fixed that concept कि बिल्कुल ठीक बोल रहे हैं. This is the strategy. Okay, and yes, ma'am, I want to also take this opportunity. I have one mnemonic in pathology.
Please मुझे बता
मुझे
दीजिए.
मुझे
I,
मुझे
I
now
thought
I always
And
used to tell them not to tell you this. हर class में मैंने mention करा है that do not tell Neha ma'am about this.
मैंने पता है क्या सोचा है लाइक ये स्टारी आई रिमेम्बर आई हैव सीन दिस मुझे लगा वी हेट पीएसएम ओहो कोई बात नहीं अभी पीएसएम को
PSM comes in a
आता
lot. Samoma bodies ka bhi my mnemonic is PSM. PSM comes in a lot of places in my mnemonics and path, but there is genuinely one mnemonic which is a flea bitten kidney ka mnemonic hai. We hate PSM. So yeah, I mean, I think someone remembered it because we have never shared the screen virtually before. So someone has Tari has remembered it and at the right time, in the right moment, has just leaked it out. But I think I can just be a little embarrassed and let it go away. so so
yes
thank you, and but I just want to say sorry also for making that
no
mnemonic.
no मुझे
Honestly
तो
saying that I never liked PSM in my third prof. मतलब बहुत मुश्किल से वो पाक वाला book तो I still remember is quite a nightmare for me. So hats off to you on how you study and simplify it. But मतलब it's very difficult. Rank under, yes, one. There's another question for a rank under 1K. Should PYTs be enough?
even for under 1k rank pyts are enough if like you're targeting 1k rank right now any even if you were targeting 5000 within 5000 or within 1000 pyts so will definitely play a role because they are only going to tell you कि कौन से topics कब पढ़ने हैं कितना पढ़ना है so I think you cannot ignore that you have to do it whatever rank you are aiming but if you're aiming for 1k rank right now you should be in a position कि जो 10-15% वी आर सेइंग विच इज अनप्रिडिक्टेबल उसमें तुम्हारा थोड़ा सा क्लच होना चाहिए दैट मे बी यू have read certain topics which might be expected or are not even expected you've gone and done a little in-depth reading of the entire of all the topics of the main subjects or even this है ना but pyt I think meant pyqs only right है ना okay. PYQs ऐसे भी important है whatever rank you are aiming. So right now since time is crunch over here, PYQs with notes and be consistent. I'm sure whatever rank you want to aim, you can achieve. What do you think, ma'am?
Totally. Matlab, see, if you're, when you have a time constraint, I would just say divide your day. Like pick up any one day and see your notes will always be your primary source. Whether you're aiming for rank one or you're aiming for any rank, notes is always going to be the primary source. So notes, revising it, there is no number of revisions. As many times you can revise, you have to revise. That is one thing. But when you're aiming for a special kind of a rank, what makes a difference is like we say ना कि एक सब्जेक्ट का सिंगल सोर्स रखना है सो दैट इज गुड फॉर योर नोट्स सिंगल सोर्स बट फॉर एमसीक्यूज hundreds of sources, and by that I don't mean that every MCQ you sit down to read the explanation and waste one hour in every. When I say practice MCQs means if you get it right means you obviously know the explanation, move forward. Only when you're practicing MCQs from multiple books, multiple platforms, multiple teachers, that is going to expose you to all the different possibilities of questions that can come. So notes के लिए single source and MCQs के लिए multiple source. If you're targeting for an under 1K rank, that would because now we have time constraint also. We have less number of days. So that is what you can apply. And how many MCQs should you practice per day? I never give a number because I
Exactly.
think number creates unnecessary depression. What if like you are doing 50 and I say कि नहीं 150 तो करना ही करना था. And then to full night you will end up thinking that what
Exactly.
am I. I'm just saying that जो कर रहे हो that tomorrow just add 10 to that. Okay, tomorrow just add 10. So just keep increasing on your own. You are your own competition. You don't have to compare with what someone next to you is doing. Someone might be doing 200 MCQs because that person is only doing MCQs all day long. You are probably doing notes and MCQs as a combination. Everyone has a different way of studying. तो ऐसा कोई number नहीं है that I can give to you, but I can just tell you that whichever baseline you are at this point of time, from tomorrow onwards or after every three days, keep adding 15 questions onto that. And now we are closer to the exam, so at least try every day 5 7 questions extra karo so that you gradually reach that level where you should be maximally be doing the number possible. So that is how you approach the number wala question.
ये
Okay.
तो मैंने ना आई हैव सीन पर्सनली ऑल्सो लाइक आई वुड से कि आई विल डू 50 MCQs every day, है ना, एंड आई जस्ट एंडेड अप डूइंग मान लो 15 or 20. So I was like, oh, again I wasted time. That thought comes to your mind, and agla din bhi, the next day also is kind of a waste, thinking ki yesterday I did not study, did not complete my target. So it's better, like ma'am said, give yourself short targets, like just start with 10 MCQs ही कर लो यार, फिर कल कर लेना 15. Gradually you can increase it. And like she said, abhi to you should stick to smaller numbers only. Just having a look at the MCQs is enough, but don't set targets which will demotivate you, or will will lead to wastage of time. So gradually increase, but don't go beyond a number which is not achievable. पढ़ते हैं ना हम लोग, पीएसएम में फिर से आ गया, हम लोग पढ़ते हैं that you don't have to set numbers which you can't achieve in planning and management. Same goes here, I think. Yeah, absolutely right. Give yourself smaller numbers and then do more. वो तो अच्छी बात हो गई if you end up doing 20 instead of 15.
Right. So Dr. Prem is saying that instead of doing PYQs, you like to prefer to. I was also, see, I'll tell you, I was also on the same track once upon a time when I used to, there are two set of students. Entrance exam, हमेशा two set of students. One are the students who go topic wise, पूरा
Hmm.
theory पढ़ा, then they do the questions, then they do the explanations, they shut that chapter, they move on to the next subject. That is how one set of students study. Second set of students are the custom module students who read their notes 1 or 2 months or scattered way mein, and then they are just now they feel that notes bar bar padke I am not, like Dr. Bhavya is saying, notes bar bar padke ma'am I am not able to understand or not able to recall that much, but when I start doing MCQs my mind works more. So you are belonging to the second set of students. To each his own. I was always the first set of student. I always wanted to go in an orderly manner because I used to suffer from that FOMO that ye chapter mein ye reh gaya, wo reh gaya, that kind of a thing. So I used to pick up chapter 1, notes, MCQ finished. Then chapter 2, notes, MCQ finished. So that is how my brain is wired, right? From the beginning, that is how I have studied as a kid, as a teenager, as an adult. So that is how I used to study. If you put me into custom module, I'll start panicking. I cannot, my mind will not function. But same way, like Dr. Bhavya is saying that if you put me only towards notes, then it's nothing is wrong. See, there is nothing wrong and right. I'm just saying there are two kinds of people and both of them are right. You just need to identify which kind are you falling under. You don't have, the mistake that you will do is not falling in either of them. The mistake is that you will do is copying someone else which you are not. So वो नहीं करना है. So if Dr. Bhavya, if see, and what is your analysis? Although I say वो analysis नहीं होना चाहिए, but all of you say कि analysis हमारा grand test score होता है. If I
Hmm.
get a good result in grand test, I feel I'm doing well, and although that should not be. But see, Dr.
Exactly.
Bhavya, if you are getting a good score in your grand tests by doing MCQs more than your notes, then why are you worrying? Then don't just think that someone else is doing the other approach. तो दूसरे का approach हमेशा अच्छा ही लगता है. Honestly, that I will always feel that कि मैम का पीएसएम का सब्जेक्ट माइक्रो से आसान है, मैम को लगेगा अरे माइक्रो पीएसएम से आसान है. सो दैट वेज, बट ऑल ऑफ अस नो कि दूसरे का सब्जेक्ट हमेशा ज्यादा इंटरेस्टिंग लगता है, तो दूसरे का स्ट्रैटेजी भी हमेशा ज्यादा इंटरेस्टिंग लगता है. So that ways it's always that you find what the other person is doing is more fruitful and you have the wrong strategy. No, you also have the right strategy and he also has the right strategy because it's working both ways for you, right? So you're doing more MCQs versus notes. जब तक याद हो रहा है तो good enough. Now, why do you want to doubt yourself? Ma'am,
Hmm.
there's another question from Dr. Sakshi, that is, how frequently at this point should they be given GTs?
Okay, so like you said a very good thing that many of your students get worried about your grand test score. Please, please, please don't get worried. GTs को ना कैसे लेते हैं? Like जब हम लोग भी देते थे, like when we used to also give, first of all, never stretch analyzing your GTs. I'll tell you how many you should do, but like if you've given a GT today, try to wrap up looking at the GT. What I preferred in the next 2 days only. Don't think I'll keep 10 questions today, again 10 questions tomorrow, again 10 questions tomorrow, and stretch a GT analysis for 1 week, 10 days. Your interest goes away. Whatever questions you know, look at the explanation, go to the next question. If you don't know, now is not the time when you're going to get into the depth of that particular question which you're not able to figure out. You just go through its explanation, usko samajh lo, dimag mein bitha lo, and then again move to the next question. Don't waste your time on this ki ab this question, if this only turns up, how will I approach? Read the explanation, go to the next question, and wrap up. Now, when we had time, we were telling ki, okay, at least try giving a GT, 2 GTs in a month. You know, that would have been, I think, sufficient. But the important thing is, even if you're giving 1 GT in a month, the important thing is to do its complete analysis on time. And if you found out something new for a particular topic, just say PSM में ही, if you found out something new for a national health program, okay, which we might have missed, just go and quickly add it to your notes. So whenever you're analyzing GT, keep your content also with you, keep adding points on that, and don't worry about your GT scores. They cannot, they cannot kind of they do not very correctly, I would say, decide your rank, because it's what you are going to do on that day is also extremely important. So Abhi, since you have just a month remaining, maybe 1 GT also if you do, yeah, 2 bhi kar lo is good enough. But don't spend a lot of time analyzing it and worrying about it. फिर तो एक दिन waste हो गया, 2 दिन waste हो गया. Don't do that. So I think GTs are just to check how is your preparation going, which subjects you need to put in a little more effort, but they are not actual deciders. It's very different, I would say. What do you feel, ma'am? आपको क्या?
मतलब two or as ma'am said, 2 GTs at this point of time, and if you are like more of an MCQ kind of a person over notes, then 3 GTs de do. That is up to you. But 2 GTs are good enough, and analyze them well. And at this point of time, GTs में time management more than focusing on correct, incorrect, and getting it right or not getting it or recall. उससे ज़्यादा these two next GTs focus on time management and give it at a time when your exam will be, because like Dr. Prem was saying in the in between, that sleep cycle has become so bad because of studying. So all of us have had that problem, and I always tell students, last 15 days में अपना sleep cycle exam time के हिसाब से set कर लो. If you're a night owl, if you study all through the night and sleep all through the morning, that is not going to happen in the exam, right? You will have to stay up and you have to train your mind that every morning I have to be alert. Exam has to be in that morning, in daytime. Basically daytime my mind needs to know how to work. We have as medicos trained ourselves that our mind only knows how to work during the night time and sleep during the day in our preparation. So in the last 15 days, get your sleep cycle back on track so that you're sleeping at the right time and waking up at the right time. And don't worry, Dr. Prem, there is no one who has ever slept in the NEET PG exam. Even if you have not slept since the past 5 or 6 days at a stretch, the NEET PG tension is only so much that it will not let you sleep. So rest, be assured, वो नहीं होने वाला.
PSM is what I'm learning on a daily basis. ये तो बहुत अच्छा है. There are so many, PSM is one such subject where there are a lot of posters on display. And you know what happened? Once I was teaching them nutrition, उसमें there's a topic food logos, okay? And food logos में there's an image of BIS. ठीक है, Bureau of Indian Standards, all right. And BIS mark is not just there on food products, but it can be there on jewelry or any other thing. So एक student ने mention भी किया that he had gone to take jewelry with his mother, और वहाँ पे भी उसको BIS mark दिखा. So PSM is one such subject which can be used a lot of places for your learning also. Shops you will see some logo, at any government this thing, medical colleges में तो रहता ही है. So I think that's a very 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 good thing that you keep looking at images, and I'm sure कुछ images turn up भी हो जाते हैं हमारे exam में. So that's very
Right.
nice.
And as they say, right, if you're seeing, it's not that, see, the PSM posters and hoardings were always there. It's just that आप पढ़ाई इतना कर लिया ना, now your mind knows so much of that your eyes are only seeing that part. So I'll share a very funny incident. At least PSM तो you see all around you. I mean, it's a part of your general awareness also. Path and micro कहीं general day-to-day life में आता ही नहीं. So you will not believe that once there was a student next to his study in his hostel. So obviously hostel has space constraint ना, वहीं पे table है, वहीं पे your utensils are kept, वहीं पे everything is kept. So he was studying. He sent me a picture of his table, and on the side of his table there was a broom kept. The झाड़ू का
अच्छा.
photo he sent me, and he actually said that okay, this is broom appearance that we see in Penicillium marnifi. And he was like, everywhere that I'm seeing, now that I've read so much of path, so much of micro, that everything that I'm seeing, my mind is actually making me realize that, okay, broom looks like what, and paintbrush looks like what, or a pencil looks like what. So, like you said, you not started suddenly. PSM hoardings have not become enough. वो हमेशा से थे. PSM hoardings and all these general awareness things were always around you, just that your eyes will see what your mind knows, and now your mind is only knowing neat PG information, तो अब वो ज़्यादा दिखने लग गया है. But it's good that if you're noticing it, means you're revising also, and it's a good sign, right?
एग्जैक्टली एग्जैक्टली, जो आप पढ़ रहे हो वो आपको हर जगह दिखे, और अब दिखना भी चाहिए एक्चुअली. माय टीचर दे यूज्ड टू टेल अस दैट इवन इफ आई वेक यू अप एट नाइट एंड आस्क यू समथिंग अबाउट द मोस्ट कॉमनली रिपीटेड टॉपिक, इट शुड बी ऑन योर टिप्स.
Your
और वो
tips.
नींद में भी बताना है वो, और ऐसा हो भी जाता है. आई थिंक you get into that this thing that you're always thinking about that, but then again we all need to remember that it is a phase of life. Okay, it's not your regular life, and take it with face it with don't take it as a burden, क्योंकि उससे तो नहीं काम चलेगा. Take it as a challenge. You've already like you've already trekked more than almost, the journey is now going to get over, so don't think of giving up. And remember that you've put in a lot of dedication, devotion, determination. So you just have to trek a little more, be consistent every day. And many students also ask कि क्या अब हम 10 घंटे पढ़े, 12 घंटे पढ़े, 15 घंटे पढ़े. So again, numbers would not matter, but you have to be consistent. If you studied 8 hours also today, please don't not study tomorrow. Don't do that. You have to be consistent, and you just have to focus right now. Stay away from negativity a little, and think good things. And this phase will just pass. I think with the you have to be there. Don't give up, and don't let others deviate you right now from your track. That is very, very important.
Right. Not gaining confidence in a particular subject. See, Dr. Bhavya, never will you know why are you not gaining confidence, is probably because you're wanting to say that I should know 100% of every subject. Firstly, accept the fact that no one knows 100% of any subject. I don't know 100% of path. Ma'am will also agree that हमें अपना भी subject 100%, you ask us with full updates and everything happening globally. No one knows everything about any one subject ever, no matter how many years you study that subject for. So how at this level with 19 subjects in hand, why are you even putting yourself under that pressure that you should know everything? किसी भी subject में PhD नहीं करना. That is what I always tell students. You do PhD in one subject and don't study the other 18, you are not going to get a good rank. But if you do the most important 80-85% of every subject, that is a better approach, and that will help you get a better rank and a better branch also. So when I say you're not gaining confidence, that is because you are aiming that I should know pathology from cell injury to hemat and blood banking word by word. No, you don't have to do that. That is again coming back to where we started from. Okay, 80-85% of the subject is what? Previous year topics. If you have mastered those, learn to get satisfied and contented with that much. The problem is that with all that FOMO and so many things happening, so many classes and so many people giving you so much of advice, you feel that you have that element that I should read from here and from here and from here. That is why we say one source. And start trusting yourself. Last ka 1 month na, more than what you're studying is also about your mindset. Start having faith in that what I am doing is the best approach, and no matter what everyone else, even if everyone else is reading a different book, but if you are understanding from one particular book, you will stick to that. So it's about who will win the race, and that person will win the race who has a strong mindset, who is very confident that जो मैंने करा है वो ठीक है. That person is going to win the race. And remember, I always say that that final day is like a war. Okay, you will win the war, but before you reach there, there will be little small battles that you will lose. So these daily struggles, these daily battles, you will lose them, but don't consider them as any setback. They are stepping stones. You will lose these battles, but you will win the war. and it's more important to win the war than to win the battle. So minor inconveniences will come, confidence will go down, you will feel demotivated, depression hoga, you will, I remember that we used to stop talking to anyone at home. We used to move away from our friends. We used to become very snappy towards our parents. Unnecessary attitude we used to give to random people, because that is how you are na. You become so tensed and anxious and panicky because of what is happening around you. But ठीक है, उन सबको बाद में sorry बोल देना. At this point of time, just be very very headstrong and just focus on my 19 subjects, and now you guys have a 20th copy also, so chalo my 20 copies. That is what you focus on, and no 21st copy after that. No matter what anyone comes to you and says कि मेरा ये source better है, तुम्हारा गंदा है, या जो भी, नहीं सुनना. My source is the best source. That is what you have to tell them. Okay. So yeah, that's about it, and done for the end. I think these talks will never end, ma'am. So I
Exactly.
think we should call it a session.
Yeah, like ma'am said, please, don't get worried about the smaller things that are happening currently. Just stay focused. और कुछ दिन है, just put in your best, be consistent, keep revising, keep looking at things that you want to. Don't try anything new, and just and stay healthy also. Please eat good food right now. Stay hydrated. That is something very very important. And stay safe from cold also. Don't fall sick. That also you have to take care of. Yeah, I think
Right. So we are sorted for the day. So thank you
yes.
guys for joining in, and I hope we've been of some use. FMG students, if you are still here, so just go. You should not be here. It is your day to sleep, catch up on sleep, and you should not be here listening to future advice. Your time will come later on. But for NEET PG students, I hope we've been useful. So thank you. And for those who were asking, I just found this, so I'll show it to you. For those who were asking, I think Dr. Bhavya and others were asking about any क्रैश कोर्स गोइंग ऑन, तो ये ऑलरेडी चल रहा है एक बैच. आई थिंक इट्स द रैंकर्स बैच एंड द मास्टर्स नीट पीजी बैच. तो इसमें देयर इज गोइंग टू बी अ टीएनडी. आई थिंक लाइक मैम वाज आल्सो टेलिंग यू ना कि
Hmm.
का भी टीएनडी चल रहा है. तो डॉक्टर भव्या, देयर इज अ पैथ एंड माइक्रो टीएनडी अंडर दिस आल्सो. यू कैन कॉल दैट अ क्रैश कोर्स, व्हाटएवर you may want to say it. But yeah, there's going to be like a 4 hours of rapid revision patho, 4 hours of rapid revision micro, and there's going to be a 5 hours of TND alag se. So basically February is all about revision and in a very rapid kind of a manner. So that's the module, or that's the batch that you need to follow, that you were asking about. Okay, right. So I think we are sorted. Yes, ma'am.
Yes.
Thank you. अच्छा, हाउ वाज एफएमजी? अरे पूरा सेशन उसका था. डॉक्टर प्रेम, जस्ट गो ऑल द वे बैक, टेक योर कर्सर एंड स्टार्ट एंड गो टू द फर्स्ट 2 minutes of this video. Paper was paper 1 was good, paper 2 was a little tougher, but yeah, that's the overall one line ka take home message ye hai. Paper 1 pre para clinical subjects were expected. The clinical ones were a little off track. ECG नहीं आया, arrhythmias नहीं आया, काफी कुछ expected नहीं आया. पैरासिटोलॉजी में एग्स नहीं आए, विच ऑलवेज कम. कुछ कुछ था जो एक्सपेक्टेड था, जो बिल्कुल नहीं आया. बट एट द सेम टाइम, overall the paper was medium, not very
Maybe.
easy, not very hard, so it was a mediocre paper, right? Okay, thank you, ma'am. Thank you so much for
Thank you,
joining.
ma'am. Thank you so much.